Thanks for the introduction, and also thanks the organizer to invite SubtleMedical here to introduce some of our work in this great workshop. All right, so I will talk about deep learning powered faster and low dose imaging, MR, PET, and beyond. So I'm with the R&D team in the SubtleMedical, mostly doing MR work, but I will try my best to cover the other like PET and the other work. Yeah, so first I would like to introduce you to SubtleMedical. So Subtle builds a suite of AI-powered vendor-agnostic software-based solutions to enable faster, safer, and smarter imaging across modalities. Currently, we have two products commercially available. SubtleMR uses AI to enhance MR images acquired with shorter acquisition time, and SubtlePET uses AI to enhance PET images acquired with reduced counts by either like using reduced tracer dose or reduce the acquisition time. And currently, both SubtlePET and SubtleMR have been deployed at over 400 sites worldwide. Improving the quality and the efficiency of the imaging workflow is clinically critical. That would impact all the stakeholders. And this is also aligned with Subtle's goal to allow high-quality imaging healthcare more accessible. And SubtleMR is our solution to restore image quality for accelerated MR scans that may encounter with blurring or amplified noise or artifacts. And we treat this inverse process as a blind image restoration problem and apply the unrolled neural network to jointly estimate the degradation process and restore the high-quality image. And this framework can ensure the data consistency with the acquired low-quality image while performing image enhancement to adaptively handle different level of blurring and amplified noise. And here are two examples illustrating the performance of our SubtleMR image enhancement algorithm. And the left example has the number of phase encoding steps, and the SubtleMR can basically restore the resolution back to a similar level as the standard of care acquisition. And the right example has the number of averages, and SubtleMR can effectively also suppress the noise and still preserve the critical structures as shown in the SOC for clinical diagnosis. And also, SubtleMR is compatible with the parallel imaging accelerated scans to achieve spatially varying noise reduction. And SubtleMR is compatible with almost all of the MR exams at various field strengths used in clinic, ranging from 0.3 Tesla up to 3 Tesla. And also, those aging scanners can be also benefited from installing SubtleMR to improve image quality and efficiency via software-based virtual upgrade. And SubtleMR can be summarized as our solution for single contrast image acceleration. And SubtleSense is our approach to accelerate multi-contrast acquisition. So a clinical MR protocol typically includes multiple MR exams with different image contrasts. So this allows us to synthesize certain image contrast image by using shareable information from the other scans. For example, we can use high SNR image to improve the image quality for those low SNR scans. And one such application we've investigated is to synthesize stir image by using the T1 and T2 weighted image in spine imaging. So here are two examples, also comparing the SubtleSense stir and the acquired stir. So the left cervical spine comparison shows that the metal artifacts can be largely reduced on the SubtleSense stir image. And right lumbar spine image comparison shows that the SubtleSense stir can help to improve the image quality compared to the acquired stir. So we've also so this SubtleSense based approach would be also helpful to avoid those repeated scans due to motion if the other earlier acquired high SNR sequence are motion free. And besides improving the image quality and also the acquisition efficiency, we've also paid attention to improve the safety of our imaging by using AI. And recently, there are concerns regarding the gadolinium contrast enhanced MRI due to the gadolinium deposition within the body. And gadolinium-based contrast agents can lead into long-term gadolinium deposition within the brain, particularly for the pediatric patients. And we don't fully understand the implication of this, but it is prudent to follow the principle to reduce the amount of gadolinium usage when we do the MR scan. And also there is another recent study demonstrating the environmental effects of these gadolinium-based contrast agents, including gadolinium contamination within the public drinking water system. Again, it is still unclear what's the long-term effect of this, but a prudent choice is still to minimize the gadolinium usage. So SubtleGAD aims to enhance the image acquired with a low gadolinium dose scan to a contrast level seen in a full dose scan. And this is currently the focus of a clinical trial in collaboration with Bayer. And here is one example to using SubtleGAD to enhance the half dose scan. So the left is the full contrast dose scan, and the middle is half dose scan, and right one is the half dose scan further enhanced by the SubtleGAD. So you can see those small vessels that are barely visible on the half dose scan can be fairly well restored but after we apply the SubtleGAD algorithm. And this example it shows a similar results, but just with a 90% contrast dose reduction. And also you can see those small structures are barely visible on the 10% dose middle image, but those are fairly well restored on the after we on the enhanced image. And also the enhancing margin of the tumor can be also reliably restored. And we also try to explore the limit, try to push this technology to its limit to completely eliminate the contrast injection. And this is just one example to show that fully synthetic post-contrast image created using the pre-contrast image, along with T2 and FLAIR image acquired as part of the study. And this technique could be useful in patients where the gadolinium is contraindicated, unavailable, or the post-contrast image is severely motion corrupted. And yeah, so on the other hand, so we are also putting our efforts try to reduce the ionizing radiation dose in radiology. So radiology practice should has the responsibility to keep the radiation dose as low as reasonably possible. And recent technical advancements enables less radiation dose for a given scan. But the dramatic increase in the number and the complexity of the imaging procedures across all of the radiology has resulted in an ever-growing overall radiation dose. And to slow the trend of this increasing of the overall radiation dose, we need to still continue to push the state-of-the-art in ultra-low dose imaging. And SubtlePET is our solution to basically restore the image quality for PET imaging acquired with up to 75% reduction in counts. And the left image just showed a regular standard PET image, and the right one is shows the 25% dose and further enhanced by the SubtlePET. And SubtlePET is cleared for use on a variety of radio tracers. Here, just one example using the gallium PET scan with 50% like dose reduction. And from this example, so the noise on the right, so the noise can be fairly effectively suppressed, while those detailed structure can be still preserved well, as you can see from the left full dose reference scan. And here is another example showing the another tracer gallium PSMA with 75% dose reduction. And here is another one using the fluorine as the radio tracer, still with the 75% dose reduction. And currently, our commercial version of the subtle PET algorithm is validated to up to 75% dose reduction. And our research team is still developing new models, trying to explore further push the reduction level further. And in a recent IEEE competition, so we have demonstrated our approach to in those ultra low dose PET imaging with up to 99% dose reduction. And we took the first place overall. And here just one example case from that data set, I think. So it's this is the 90% dose reduction, and we further push it to 98%. Then we started to and at this dramatic dose reduction level, so we started to see some of the details are kind of are being lost. Currently, this is still an active area for our R&D team to further explore. And just push all the way to 99% dose reduction. So, so most of these structures are still reliably enhanced or restored. So, but still some of these structures may still missing. So we are still further do some algorithm enhancement, improvement, and also try to do some more rigorous reader studies to validate our algorithm. Also, we've applied our denoising algorithm to the fluoroscopy image supported by an NIH SBIR grant. And the major challenge for the denoising fluoroscopy image is the need for extremely fast processing to maintain the real-time display during an intervention. And currently, we have implemented our technology at 30 frames per second, while maintaining the high image quality at a 25% loss level. And here is one example just demonstrating our denoising algorithm can basically still preserve the resolution to visualize those screw threads. Yeah, and currently our validation is mostly done on the cadaveric specimen, so the motion is limited. But this video hopefully can demonstrate the real-time nature of our denoising algorithm. So we really recognize the value of all kinds of partnerships, whether for running clinical trials or software deployment or any kind of business collaboration. So you can find Subtle's product on a variety of AI platforms. So with this, I would like to stop here and take any questions you may have. And thanks for your attention.
We have time for a couple of questions.
Fantastic talk, thank you. You mentioned some data consistency constraints in your post-processing image enhancement. Does that mean that you need access to the original case-based data? Does that mean you need to be integrated into the scanner pipeline?
Not really. So we don't have the access, particularly in clinical side, we don't have the access to the raw, like acquired measure data. So we can only do like data consistency with respect to the like input DICOM image.
And does that input DICOM sometimes magnitude only? Because if you lose the phase, then
Yeah, currently we mostly just rely on the magnitude image. We also do some like experiment work to try to add the phase like image as another channel, but we didn't see actually that much improvement compared to only using the magnitude image. So yeah, but definitely we can further like try along this line. Yeah.
thank you.
If there's no more questions, let's move to the last part of this session.